Hey guys, Pearl again here, bringing you my 12-week post-op doctor's visit update. Alright, so remember I had a couple of issues that I needed to discuss with him. Please guys, if you like the videos that I'm doing, go ahead and give us a thumbs up and comment, ask questions. There's a couple of questions that I will answer that people had asked after I've spoken to Doc. He's given me the answers. Alright, as you can see, I put on weight over December. I put on about 2 kg. So I have been on a journey, and I'll share that video for you by the end of the week, how I lost those 2 kgs after December. Also been doing some serious working out, so there will be some more working out videos. But anyway, now, as you can see, waistline looking pretty amazing. I have some nice cute little shorts on because it's nice and hot here. Feeling really confident. Guys, the Tummytuck has definitely given me so much more confidence than I could ever imagine. My body, I feel amazing, absolutely amazing. All right, so remember I discussed about some of the issues of concern. Now let's show you the 12-week reveal. I don't know if you guys saw my bikini reveal. That was the I posted that. So here we go. You can see that I've still got a little bit of weight to lose, but you can also see that I've started working and I've started losing there. Coming closer, we're going to talk about the navel. All right, so we had a look at the navel and it's looking good. We're very happy, both myself and Doc, with that. The only thing is you can see it's almost like the stitch pulled it. Now, what he did say to me is that I should be massaging. So just sort of pressing on that scar tissue to release it. So without any oils or anything, he said just to release any pulling. So if your navel is pulling like mine, just press into it. It does feel a little painful when you do it, but that's the way we're going to release that. But overall, guys, I think my belly button or my navel looks pretty sexy. Okay, let's look at the scar. I'm going to try and get that camera as close as possible. First issue, puckering that has not gone away. A little bit of a doggy ear or puppy ear, if you want to call it that. That is something that we're going to be looking at. So remember, I've done 12 weeks post-op. I will be visiting Doc in March. That'll be that 5-month post-op. And then we'll discuss how we plan to. So revision is definitely in for me. So issue number 1, puckering that hasn't gone away, and the doggy ear has to be addressed. Remember that I put on weight, so what was happening was the fat was sort of hanging over the scar. That happens when the scar is a little bit high. What he did say was, when I do my massage, don't put any oil on. What happens is when the scar heals, if I can show you, the one heals higher than the other and the pulls tight. So what I need to do is massage that tissue so that the two become flat. So I will be doing, so this is how he says I should do it. He said I should apply pressure and rub it from side to side below the scar and above the scar. That's to move whatever is creating that little healing that is giving a slight weirdness there. All right, so that's what we're going to do to get that away. Remember, I don't want that little lippy anymore. We've discussed the C-section. Now, remember, I also said to you that I had an issue with my C-section. When I put on weight, I had a little fat rollicky or a little roll right across here. So we discussed that with the scar revision, because I'm definitely doing it, because I'm not happy where everything is going, we will then get rid of this scar. It will be a little low into the pubis. The reason he said he didn't do it was because we pull it too high. Now that it started to settle, we found we have excess skin here, which we can actually fix. So this will be removed, this will be pulled down. So we will have this kind of effect, almost that smiley face look. If I come this side, you'll notice that the scar goes down. We will be extending the scar. I did ask Doc, why is my scar so short? And he said, because I was a little leaner, I didn't have such a large sort of muffin top. He didn't need to cut all the way towards the side over here. If you look at these marks, these are the marks from the piping. I'm hoping that's going to lighten up, which I'm sure it will. I'm not too stressed. So this, what's going to happen with this scar, this one is going to come up. So we're going to remove that and then bring it up. So the scar will be from where the C-section is revised and taken a little bit higher. So where it is there, it will probably be taken about 2 centimeters that way and 2 centimeters that way. That will sort of help get the scar looking a little more cute, and then I won't have this sort of fat piece. You can see the little fat piece there. All right, so guys, when you are discussing your scar, make sure that you are really clear about the way you want it. Like I guess I didn't discuss it enough of how I wanted it to look. I mean, I just left it in his hands. I said I wanted it high, and that was that. All right, but I'm not too stressed about that at that point. But guys, that's my scar at 12 weeks. As you can see, it's still looking pretty good. I'm happy. I'm very happy with what I'm seeing. I was supposed to go back and put Embrace, but I'm actually not. I'm going to continue with my CBD oil and my tissue oil, just massaging and trying to get that scar tissue nice and settled, and get that sort of where the seam is, get that sort of realigned, so that even when he does cut it, I don't have that sort of line and funniness that's going on there. All right, so that is my 12-week update, guys. As you can see, overall, really, really happy. Remember, I had a tummy tuck with liposuction, and of course that fat was then transferred to the breast. Now the breast looks amazing, guys. I'm now a full C cup. I'm very happy. I was a small C, a large B, small C, but obviously with the fat transfer, I am going to say yes, it works like a bomb. So if you're not wanting, like you can see, I'll just show you a little here, there's so much more fullness in my breast. I'm very, very pleased. I almost feel like it was when I was in my 20s. And of course the rest of the fat was pulled. I did ask him how much did the piece that was cut off, how much did it weigh? And he said to me he didn't actually weigh it, but if he had to measure from what he had cut off, from say where the belly button is to the pubic bone, he said it's about 8 or 9 centimeters of skin that actually was cut off. So overall, that was what the doctor had discussed. So guys, quick one, we will be doing a revision of scar. We will be talking about, at my 5-month post-op, we'll be talking about how we're going to go forward, whether we need extra liposuction, so we'll be doing that if we need it. And of course, we will then readdress that scar, which is amazing. I'm very happy about that. So and guess what? He's not going to charge me a whole new amount of money. He's just charging me for the instruments and that he's going to be using in the time. So I'll be having it done in his room. So it'll just be cutting off, pulling the skin down. I'll probably be awake with some anesthetic of some kind. I'm not too stressed about it. I do have a high pain threshold. So guys, if you like my videos, please go ahead and like. That was my Tummytuck 12-week post-op doctor's visit update. So guys, keep watching. If you like my video, give me a thumbs up, like, comment, ask more questions, and I will do my best to answer as we go. Look forward to my other video on gosh, my people, my brain is a little bit choop. Okay, look forward to my video on kettlebells. I've got a 3-minute workout that works the entire body from up to the bottom. But yeah, as you can see, there we go. For me, I feel absolutely amazing. So thank you very much for watching my videos, and we'll chat soon.